Good morning and welcome to Urban Update. I'm Byron Barnett. On the program today, the incredible success story and journey of a DACA recipient who is now committed to inspiring others, drawing from her own struggles. We'll give you the specifics later on in the show. Also this morning, the link between strategic networking and career success. We'll hear from author and speaker Juliet Mayers in just a few. But up first, the Massachusetts Health Connector recently launched a first-of-its-kind campaign to reach eligible uninsured individuals outside of its traditional open enrollment period. This particular Health Connector campaign focuses on reaching multicultural young males between the ages of 26 and 40 in gateway cities who remain disproportionately uninsured compared to the population at large. To reach them, they're using out-of-the-box strategies to bring them into the Health Connector. One of these ways is by launching a series of creative videos on digital media platforms, including Facebook, Instagram, Spotify, Pandora, and YouTube. Now, here to tell us more about the campaign are Jason Lefferts. He's Director of Communications for the Massachusetts Health Connector, and Josiane Martinez. She is founder and CEO of Archipelago, which is a strategies group charged with creating and executing the campaign. Welcome to Urban Update. Thanks for coming in. Glad to have you here. Jason, let's start off with you. Sort of give us kind of an overview of the Health Connector and the role it plays in the health insurance landscape here in Massachusetts.
Sure, great. Thanks for having us. The Health Connector is the state's health insurance exchange, and most people in Massachusetts get their health insurance from their work, but there are people who don't. They might be contractors, they might be consultants, they might be kind of starting their business on their own. Maybe they just lost a job, maybe they just moved into the state and they need health insurance. So we are an outlet for them to get coverage. And we have a program called Connector Care for lower income people. They can get help paying for their health insurance with plans that have very low premiums and low co-pays and no deductibles. So it makes health insurance more affordable to people.
Now, we should point out that Massachusetts, because this helps Massachusetts become the #1 state in the country for people who are insured?
That's right. 97% of the state has health insurance, more than any other state in the country.
But they got 3% there. Many people who are underinsured or uninsured. Who are they?
So generally, they are young men. Many of them are Latino. They are single. They don't have kids. They don't have a family. And that's been sort of consistent over the last handful of years as we kind of look at the uninsured population. It's pretty consistent. They can be a little difficult to reach, and that's why we started this campaign with Josiane and Archipelago.
Okay, Josiane, now you've been charged with trying to reach these groups, these multicultural young males in gateway cities.
That's right.
And just tell us, I guess, sort of take me through, how you researched the group and what did you find?
Well, we are basing our campaign in the data from the Center for Health Information and Analysis, and we put together a couple of focus groups with young males within the ages of 26 and 40, also uninsured. And what we learned from them is that they find the process of getting health insurance a bit complicated. They don't understand the importance of having health insurance. They are low risk adverse, and in some cases, in something particular that we learned also is the influence that women in their lives have, right? Their girlfriends, their mothers, their sisters. If women help them navigate the process of get health insurance, they most likely will end up getting health insurance.
Now, how are you planning to reach this group?
Well, we have right now a campaign running in Facebook, Instagram, Spotify, YouTube, and we put together a series of short videos that are kind of funny, right, to grab the attention of not only the boyfriends, the males, but also the girlfriends. And that's been running very successfully, bringing people to the connector, health, the information on the website, and also to the phone number where they can get assistance in their own language.
Well, why don't we take a look at a couple of those videos? We've got a couple of the public service announcements. Let's see what they look like. Roll the video.
Good news! I found a new job! I'm gonna be a babysitter!
Do what you want, just get health insurance.
Yeah, she's right. Just get health insurance through Massachusetts Health Connector.
Are we seriously doing this?
What do you mean? It's gonna be awesome.
Listen, there's something I really want to ask you. I think it's time that you take the next step and finally...
Whoa. 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 Whoa.
Get health insurance!
Yeah, she's right. Just get health insurance through Massachusetts Health Connector.
Very good, very funny too. I find it very interesting that that you're using the women, the wives, and their girlfriends.
Oh yes, and not only I forgot to mention that we also have radio spots of girlfriends talking about their boyfriends without health insurance, and how that is a deal breaker.
But the target group is the boyfriends, is the young men.
Yes, but the girlfriends are influencers, and we want to get to them as well.
Okay, Jason. So talk to me. What's the end game here? The long-term strategy you're trying to accomplish here?
Sure. So we want everyone in Massachusetts to have health insurance. That's our goal. We want every single person to have coverage. That means if somebody gets sick, they can go to the doctor. They don't have to pay a lot of money. If they were in a car accident or they were bungee jumping and got hurt, they they could go to the emergency room and be covered and not have to worry about a big bill on the back end. We want everyone to have health insurance, and we know, like I said, this is a tough group for us to reach, and that's why we're trying this sort of creative way to get right in front of the people who are most difficult to reach and get them into coverage.
Now, Josiane, where are some of the places we can expect to see the Health Connector in the community?
Yeah, well, that's a good question. So we have a series of activations happening from now to the end of July, and what we're trying to do is meet people where they are. So we're going to go meet them at clubs, and we have an activation in Mojitos in Randolph, and we have another activation in Blues in Lawrence. So hopefully we get to talk to them. We're bringing with us influencers, some of the actors that were in the campaign, and we hope to have a good time, but at the same time reach the population that we're intended to reach.
And I guess talk to me a little bit more about why it's so important for this particular group. These are, I imagine, one of the reasons it's difficult because they're young men, they're young and healthy, they feel invincible, and But why is it so important to reach these guys?
Young invincibles are the term that everyone uses, and I think when the Affordable Care Act came into play, there was a lot of talk about how to reach young invincibles, and we've been trying to get there, over the last 4 or 5 years. And they're no different than anybody else. They should be able to go to the doctor when they need treatment. They should go to their annual physical, get preventive care when they need it. It's that peace of mind that people have, and we hear it a lot from people. They say, I don't need health insurance, it's too expensive, I can't get it. And then once they do get it, they kind of come back and say, I'm really glad I have it. I just know that if something happens, I'm covered.
Yeah. Okay. Josiane, anything you'd like to add? I guess, but the message what you're trying to get across to people in these ads? That
getting health insurance doesn't have to be complicated. That could save you money. That it provides access to health, and it gives you that peace of mind, right? That no matter what happens in life, you can do whatever you want, but you should get health insurance first.
Okay, and we'll leave it right there. Josiane Martinez and Jason Lefferts, thanks for coming in. And any of the young invincibles out there listening right now, listen to what they say. Go out there and get the health insurance. So, coming up next, we put a face and a story to the much discussed DACA program right here on Urban Update. We'll be right back.